Federal Drive is presented by GEHA, Government Employees Health Association, proudly providing health and dental benefits to federal employees and their families. Visit GEHA.com.
OPM's request for more granular FEHB health data and the Postal Service's suspension of employer pension contributions raise separate issues, but they share common questions about privacy, authority, and long-term trust in benefit structures. John Hatton joins us with NARFE's perspective. John, it's great to have you on the show this morning. Thanks for joining me.
Thank you for having me.
We've got a couple of things to talk about. The first is a new request from OPM for medical claims data. They're looking for detailed medical and pharmacy claims data from FEHB and Postal Service health insurers. What is this all about?
This was a recent notice, came in December. They were requesting comments. It got a little bit more attention in the last couple of months. And this is something OPM has requested before, as far back as 2010 under the Obama administration. It had some pushback from the insurers, the plan carriers at the time. It has pushback this time as well. They were closer to developing a system of de-identified claims data sharing, a few years back, but it still hasn't got there. So OPM, I believe, or the generous way of understanding this action is as an oversight agency looking to analyze this claims data to help drive policies that are going to improve health outcomes or reduce costs. But their notice was very short on details. It didn't explain why they needed the data, how they were going to use it, if they were asking for personally identified data or personally de-identified data, how they were going to receive that data, if it was in a de-identified form, how they're going to secure the data so it is not stolen by a nefarious actor. We've seen data breaches in the past with OPM. And I think OPM itself is, yes, it's an oversight agency of these health insurance programs. And I think like CMS, has an interest in potentially having some claims data in the right form. But it's also part of the federal government and is therefore the employer of millions of federal employees. And what we see in the private sector is HIPAA tries to protect employers from having data on their employees. And I think it's very understandable that federal employees wouldn't want their employer having access to this. Are they going to, you always have to think about the worst case scenarios of data. Could you retaliate for employees? Do you want to, fire employees that cost more to cover because your health insurance costs are higher for them? And so you really do want that firewall in place so that the employer cannot use the data in the wrong way. And I'm not saying there's any plans to do that or that's the result behind this. But I think you always want to have those protections in place so you have security about your health and the privacy of that data.
Do you see a signal here about how OPM might be trying to manage the health benefits program differently going forward?
I think it's hard to say, but, they always come up with a call letter that asks for changes in policy coverage of certain things, what they might incentivize insurers to do in terms of how they're covering procedures or medications. Does one type of thing have a better outcome than another? Seeing longitudinal data from, if you even have de-identified data, but you can track how it impacts, how one person's healthcare impacts them over time and how some of these things work. So I think there's legitimate interests that they could potentially use, but there's also some nefarious or bad things that could be done with the data. So I think it's about really making sure it's done in the right way if they want to do it. And I think their notice was very, very low on details, very low on the types of explanation of what they want to do positively and how they're going to prevent the negative impacts.
Is there anything that folks who are currently enrolled in FEHB need to do differently at this point to protect their data?
No, their data is going to be with their health insurance carriers. So right now, there's the same potential security risk, but they have, health insurance carriers that are trying to protect their data as best as possible, knowing that there's always cybersecurity risks. But, making it known to your members of Congress that this is a concern for you and that this should be done the right way, I think is one thing you could do.
I'm speaking with John Hatton. He's Staff Vice President of the National Association of Active and Retired Federal Employees. John, let's switch to another group of federal employees, postal workers. The U.S. Postal Service has announced it will temporarily suspend its employer contributions to the FERS pension fund. And they made that announcement a couple of weeks ago based on testimony to Congress. So what's going on here?
Well, USPS has another cash crunch. We can get into why that may be, but they've decided, in our view, prematurely to suspend these contributions. The law requires them to make these employer contributions into the fund. They're still taking money out of employees' paychecks and sending it into the fund. So in our view, they should send their employer contributions as well. It's not a near-term risk that anybody's not going to get paid, but this is the funding mechanism that ensures that there is budget authority and funding to provide these benefits down the road for both federal and postal retirees. So you stop putting money in, eventually at some point in the future, there's not going to be money there to go out. And in our mind, it's a really bad precedent to set to do this. And it's really Congress's role to change the law, not the Postal Service's role to decide not to follow it.
When the Postmaster General testified before Congress, he heard back from some members that there were going to be no more bailouts for the Postal Service. So what does that mean for folks who are currently affected by this delay in payments? Might those payments never catch up?
Well, if there's no resolution in the Postal Service's financial situation and they never start to repay back this money, there is going to be an unfunded liability in the fund. I don't think that's going to get there. I think, what does a bailout mean is really up to interpretation. I think what we see with the Postal Service is that the value, it's directed to provide a universal service mandate, 6 days of delivery, each day a week to pretty much every address in the country. That's costly. Now, it's supposed to be able to pay for that through ratepayers and with a monopoly on service for first-class mail. The value of that monopoly has greatly reduced. So the cost of the universal service obligation are greater than the value of the monopoly. And so that kind of design of how this works out to be able to provide that without any taxpayer additional assistance makes it more difficult. So, that monopoly may be reducing because you have internet, you have declines in first-class mail, you have private sector competitors. And so it has been dealing with this trend and this financial kind of difficulty in terms of the cost and benefits not balancing out for some time. Now, are there short-term solutions to this that don't really address that main problem, but that give them some breathing room and get at, just improve their short-term financial situation? Yes, and I think Congress is looking at those as they did in the hearing. So one thing they could do is extend or increase the borrowing limit that the Postal Service has. It's not been increased since 1990, so most private sector companies would be able to go out and borrow more to finance their operations rather than have some artificial legal limit. Can they look at investing some of these funds in their retirement plans somewhat differently, or at least to start in the Postal Service Health Benefits Funds to reduce their obligations for past liabilities? The Postal Service wants to have some congressional decision that they're paying too much for old CSRS liabilities that are related to their obligations when it used to be the Postal Department. And there's these amortization payments for that. Now, that's really a decision of who pays the Postal Service, ratepayers or taxpayers. In our view, as long as it's being paid into the fund, we don't really care if the Postal Service is paying those amortization payments or if the Treasury is, but that's a decision for Congress to make as well. So there's things they can do in the near term to resolve the situation, but I think there's a longer term issue regarding that balance between the value of the monopoly and the cost of the universal service obligation.
And is this affecting pension payments to those who are already retired?
No, it's not. The Civil Service Retirement Disability Trust Fund covers all federal and postal retirees and their survivors, and it has more than $1 trillion in the fund. To the extent there's unfunded liabilities in the CSRS portion of it, because agencies didn't pay the full kind of dynamic normal cost, that's paid through amortization payments from Treasury. The FEHB system is designed to be financed to that dynamic normal cost. That just means accounting for things like cost of living adjustments and raises over careers and things like that. So every year there's a different contribution level set that's designed to make sure that's fully funded. So as long as everybody's paying in that specific dynamic normal cost, we'll be fine. Now, if the Postal Service decides to stop doing that, then we start to have an issue. But again, that's a long way off when the fund has more than $1 trillion.
I've been speaking with John Hatton. He's Staff Vice President of the National Association of Active and Retired Federal Employees. John, thanks so much for joining me today.
Thank you for having me.
We'll post this interview at federalnewsnetwork.com/Federal Drive. Hear the Federal Drive on your schedule. Subscribe wherever you get your podcasts.